Welcome to Natural Healing. We're going to start off talking about oxidized LDL. You know, LDL plays many important functions in our body, transporting antioxidants, building muscle, fighting infection. What's the difference about oxidized LDL? Dr. Mark, this is really an evolving piece of information here, isn't it?
Well, it's very important. In conventional medicine, there's a lot of focus on lowering total cholesterol and even more so LDL cholesterol. And that's what the drugs do. They really lower your LDL cholesterol. And studies show there's some benefit to it, but there's also many risks involved with this type of approach and the drugs that are used for lowering your cholesterol. But recent research has shown that your oxidized LDL, and that's when your LDL cholesterol becomes damaged, is one of the most important things that you can now measure.
So when you're going to the doctor's office and they're checking your total cholesterol, what are the new tests we need to do now? That's a lot now.
Well, that's true. I mean, most doctors still test the old markers. You have your total cholesterol, you have your LDL cholesterol. Some people call it the bad cholesterol, but as you said in the beginning of the show, it actually serves many purposes in the body. They measure your HDL, or your good cholesterol, which transports cholesterol out of your arteries, and they measure your triglycerides, which are the fats in your blood. And there's some value to this type of testing, which has been done for decades, but studies show it shows you about 25 to 30% of your cardiovascular risk in blood tests. Over the past 5 years, there's been more focus on testing your LDL particle size. So not just your total LDL number, but the size of your particles. We know the larger, fluffier particle sizes are the ones least likely to embed into your arteries. And now with even more emerging research, we fine-tune that, and cutting-edge physicians, such as ourselves, are measuring the oxidized LDL, the damaged form of the LDL cholesterol, which when your LDL cholesterol becomes damaged or oxidized, just like metal rust, that creates inflammation in your arteries and starts that cascade of inflammation where plaque starts to form in your arteries.
Okay, so now, of course, I'm concerned. How is my LDL going to become oxidized?
Well, there can be many different reasons why your cholesterol becomes oxidized. Number one, you don't have enough antioxidants in your bloodstream. So good antioxidants you mainly get from fruits, vegetables, nuts, and seeds. You can get them from whole grains as well. Maybe you're exposed to pollution in the air, pollution in the foods and the water you drink. That can create this oxidized LDL. Even things like stress, studies show, creates inflammation, creates oxidation in your body. So there are many factors people can address, but first you have to know it's a problem before you're motivated, you and your doctor, to deal with it.
Okay, so I would say we all have those problems, right? We all have stress. None of us eat enough, well, I don't eat enough fruits and vegetables. So let's say I have major oxidation damage of my LDL. How am I going to treat that conventionally? First of all, do conventional doctors even look at that as a problem? Do they even test for it?
No. I mean, right now really is not a standard test done in conventional medicine. The test is available by labs. Your doctor can order it. I do order it with my patients. And there's different ratings. With your LDL cholesterol oxidation, you can have a normal amount, you can have a mild elevation, you can have a moderate, or even severe. So especially people with a strong family history of heart disease, you yourself have been tested and been shown to have some degree of plaque in your arteries or existing heart disease.
What about the people that are on statin drugs to lower their cholesterol? Is that going to affect at all the oxidized LDL?
Very good question. No, I mean, there's been no research showing that the statin drugs reduce that oxidation of your LDL cholesterol. And remember, what we're talking about here, we're talking about heart disease at a much deeper level than, say, your total cholesterol, your LDL total cholesterol. We're talking about actually damage that's occurring to your LDL cholesterol. And I want to tell the viewers what happens with that. And what happens when your LDL cholesterol becomes damaged, as I mentioned, it creates inflammation in your arteries. And that attracts immune cells into your arteries, which creates more inflammation. And that starts to form plaque in your arteries, and it makes your blood vessels less elastic. So your blood vessels actually have some flexibility to them. And so the less flexible your arteries are, the more apt they are to rupture. So not only do you build plaque more readily in your arteries when your LDL becomes oxidized, they become less flexible, so they can rupture further. And studies show also you're more prone to forming blood clots when you have oxidized LDL traveling throughout your blood system. So yeah, in conventional medicine, most doctors aren't testing oxidized LDL. I predict in the next 3 to 5 years it will be a routine test, certainly superseding the normal cholesterol panels that are being done now. Plus, you know, there's studies out there. I mean, there's been studies like in evidence-based medicine a big meta-analysis looking at many different studies with over 65,000 people. And they found that there was no relationship between your cholesterol levels and survival rates in regards to heart disease.
Wow.
And of course, like many things, there's conflicting studies out there. But one of the concerns I always let patients know in regards to statin drugs, number one, they have been shown to increase the risk of diabetes in both women and men, more so in women. One large study found increased the risk of diabetes by 40% in women. Recent studies have shown they certainly can be a cause of fatigue in people, memory loss. Some studies show there may be an increased risk of cancer. And we've always known that they do carry the risk of liver and kidney damage or even irreversible muscle damage.